Hey mama, 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 I say mama, please pray for me, pray for me, pray for me. To make money, mama, and I say, to make money, mama, and I say, mama, please pray for me. Pray for me, pray for me. The one that happened to me and I say, the thing that happened to me and I say, mama, please pray for me, pray for me, pray for me. Don't care money, mama, and I say, the thing that happened to me and I say, no man, they want me to die, They want to see me in my casket before my time, and they want me to die, Mama, please pray for me. Hey mama, hey mama, hey mama, hey mama, hey mama, hey mama, mama, please pray for me. Hey mama, hey mama, hey mama, the one that happened to me and I say, the thing that happened to me and I say, mama, I want you to push for me. Pray until something happen. Pray until something happen. You must push for me. Pray until something happen. Pray until something happen. Alhamdulillah, Allah. Bleaching my color to Salah. Alhamdulillah, Allah. Bleaching my 1 cent to dollar. Road to success is narrow, all kind of temptation. But the blessing you gave me, a growing like plantation.
Hello, ladies and gentlemen, and welcome to Focus on Liberia. This is a special edition of Focus on Liberia. I'm with the FOL Health contributor and also a health blogger. That's the most talk about, somebody say, Abby Tyler. Now we're trying to, at Focus on Liberia, we're trying to introduce a new term called Abby, okay? So if you want to talk about health, you say, let's just Abby it. So that's the new terminology we are coming up with at Focus on Liberia. I want to welcome our viewers from across the globe. This is Focus on Liberia. Abby Tyler's Healthy Living, in conjunction with Focus on Liberia, is presenting this program. Tonight, we're going to be talking about what your doctor is writing down anytime you meet your doctor. Abby has told me that, do you know that your diagnosis and your treatment plan or your plan of care, all that comes from what you tell the doctor? Most of it comes from what you tell the doctor. I said, huh? If that's the case, let's have a show. Because every time I visit my doctor, she's writing something down, and at the end, I get my diagnosis, say, take this pill, do this, do that. So we're going to be talking about your doctor's note. What goes into your doctor's note, and how does your provider come up with your diagnosis and your plan of care? Again, we want to welcome all our viewers from across the globe. My guest tonight is Mrs. Abby Tyler. Abby, welcome to Focus on Liberia.
Thank you, Dennis. Thanks for having me, and hope to be a fruitful show.
Thank you. And Abby is our health contributor here at Focus on Liberia. She also has the Abby Tyler's Healthy Living, where she says she talk about the whole body, mind, and soul, healthy living. We'll talk a little bit about Abby. Let's talk a little bit about what you do. I know you're a family nurse practitioner and you're a blogger. And you also do this Abby Tyler's Healthy Living. Tell me a little bit about those.
Okay. For those of you who don't know me, my name is Abby Tyler. I am a family nurse practitioner. I work at a private practice in Philadelphia. Prior to that, I was a registered nurse for 22 years. I did 20 years in the hospital, 2 years in long-term care. I'm also a nursing assistant instructor. I'm also an RN preceptor, certified RN preceptor. So I teach a lot of new nurses. I train a lot of new nurses when they started with us. And I do my Abby Tyler's Healthy Living. I've been doing that since 2014. Try to teach, give healthcare information in relevant, culturally relevant manner to mostly Liberians over the years. But now I'm doing it to everybody. And also, I do some volunteer work for my local Liberian Association for our Labor Day. I do cookout. We'll do the cookout. Doing the cookout, I do my health fair, and also for the city that I live in. And I've been health contributor for FOL now for about a year. So that's pretty much about me.
So, Abby, we say provider's note. First of all, who is a provider, and why does a provider need to write down the note when we visit them?
Well, a provider is can be a medical doctor, depending on your specialty and all that. So internal medicine, which is also family medicine, and a specialist cardiologist, GI, can be a physician assistant and also can be a nurse practitioner. The doctors are the first high-level providers, and the PA and an NP or mid-level providers. But we all pretty much do the same thing. Depending on where you are, NPs can work independently, and other places they work in collaboration with a physician. So, what was your second question?
All right, we'll come to the second question. Now we're going to talk about the provider's note. And it got a fancy name. They say sub note.
Yes.
So when you visit your provider, they're writing down something, right? Especially with the advent of electronic medical records, they're looking at the computer, looking at you, asking you questions. What the provider writing down? What are they? Sometimes I'm like, okay, what is it? Are they really representing what I'm telling them, or they're doing their own thing? What are you writing when you are, first of all, you're a provider and you
Yes.
have patient. Now I'm before you as your patient and you are writing. What is it that you're writing?
Okay. First, the provider's note. This called SOAP note, SOAP. There are 4 parts to that note. The subjective is everything you're telling me about what's going on, your complaint that you came in with. I'm going to be getting your medications list, your family history, your personal history, your surgical history, anything else of that. The objective is when I do your physical examination based on what you told me. And if it's a complaint, like one problem, I can go ahead and do the full body and then concentrate on the part that you're telling me about. The assessment, which is the A, and that's your diagnosis. And it's a diagnosis of diagnoses, because sometimes we have several diagnoses and all that. And sometimes, like I said before, certain illnesses, they mimic their symptoms, kind of mimic each other. So we can be going for we said differential diagnosis. So we can say you came in with this and it's also that. So we can try to rule out one of the other. Always try to rule out the most important one, the most critical one first. And then the P is the plan of care. It's where we come down, we get those diagnoses, and everything you told us is where we write down the plan of care. We medication, other treatments, if we have to send you to other physicians, specialists, or in case like even if you come in there and there's something you're telling us that I'm writing down and I have to send you to the emergency room right away, I send you to the emergency right away. I'll tell you, depends on, okay, are you critical enough that you can go to the emergency room in your car, or critical enough that you have to be in the office? And I call for the 911 to come and get you from the office, which I had to do today too. So pretty much that's what it is. And today we're going to be concentrating on the subjective part of the note.
All right. Let's start with SOAP note. You said SOAP is the subjective,
Yes.
the objective, assessment, and plan of care. I want also, when you say subjective, what is that? What does that mean, and why? Because
the subjective is basically what you're going to be telling me, and I'm going to be writing down. But then that's also what we also call the history. So basically, what you're telling me about, I'm going to be asking you questions that I'm trying to get most of what it is that you're telling me in order for me to come to my diagnosis, to come to where I say, okay, this is what I think is what's going on. I get a diagnosis and I do my plan from there. So basically, it's what you're telling me and how I'm asking you for you to tell me that information.
Right. So it's subjective because it is not objective. So I get that, because what I'm telling you, I could be lying.
And basically, but in a way where we're going to be asking you certain questions and all that too, we can pretty much kind of tell, that if it's not lying, but if the patient's omitting certain information, we usually say, try to be honest and tell us everything that you you can remember, but you possibly know, because that can affect, what kind of test that we order after when you leave the office there. So it's important that you're honest with your provider when you go see them. Nobody wants to say, sometimes you'd be like, yeah, are you exercising 30 minutes a day, 3 times a week, like I advised you? And, some people be like, yeah, what, dog, seriously, no, so, but that's okay. We usually just say it's not like to punish you or anything like that. It's all about you and keeping you healthy.
So that's so you rely on me to provide the information.
Yes.
I could add to it, I could forget some, so that's subjective. And then you have the objective part of it.
Yes.
Meaning?
That's the part I'm doing the physical examination. That's when I'm touching your body and doing it. So everything I'm doing there, when I'm writing it down or entering the information, that's everything I did to you. So no part of that when you tell me, it would be saying like what you told me or something like that. No, it's everything, my physical examination of you.
And then we come to assessment, the A.
Yes.
Now you examine me. And then, so what is assessment?
It does sound like, I'm doing my assessment on you, but assessment mainly is just the diagnosis.
Okay. You have this sickness, you have this.
Yes.
So that's your assessment. And then you have your plan, meaning because of this sickness, this is what you need to do.
Yes, I'll tell you, which medication I'm going to be prescribing for you, which testing, like if I want you to do some lab tests or I want you to go for some like X-ray or MRI or anything like that, I'll tell you that. And then we'll also add to that point where I discuss what the test is about. You agree to the plan that I'll talk about your healthy living. I may mention other things too that still, because if I've been taking care of you for over a period of time, I'm also reading my other notes from prior, so I can say, okay, by the way, I'm looking at this. Did you do this? Did you do that? And other things, other screening things too when you come in. If you're a woman, other screening things that you should have had done if you're a certain age, and then going from there. And then I'll say follow up. I'll follow up when the test results and then follow up. At this time, if I don't see anything wrong, I'll say follow up maybe in 3 months or 6 months or sooner if needed.
Good. Ladies and gentlemen, if you're just joining us, this is Focus on Liberia. In collaboration with Abby Tyler's Healthy Living, we're presenting this sub-note, or what you tell your doctor. That's what determines, most of that determines how the doctor will treat you, what plan or what treatment they give you. So we're here with Abby Tyler, and she is FOL contributor. So Abby, in the subjective part, I know there are key parts to each of these things, right? So I'm with my doctor, and then I can so the 2 things you say we're going to be concentrating on today will be part of the subjective.
Yes.
That is what I'm telling you.
Yes.
So the first thing I'm telling you here is what that we want to concentrate on.
The reason why you're coming in to see me will be your chief complaint.
Right. So I'm here today. I'm your patient, right? I'm coming to you, and you say, "What are you here for?" I say, "I've been throwing out all day. My stomach is hurting. I'm throwing out." So vomiting.
So you're
hurting.
Yes,
that's my chief complaint.
Yeah, that would be chief complaint. So right away, I would probably say like nausea and vomiting, or abdominal pain with nausea and vomiting. So that would be your chief complaint.
How many, is there a limit to how many chief complaints I can give you?
You can have, usually like I said, we try to do the most important ones. If you said my I've been vomiting, haven't been eating okay, and then my toes been hurting too. So chances are more than likely we're going to go with the most important one first, which is because we have to make sure that you're not dehydrated or nothing else is going on. So we take care of that. And then I may say, I'll look at your toes later when you come back at another time. Or if whatever you came with your chief complaint is not that extensive, then we can also look at your toes. But your chief complaint would probably be your abdominal symptoms.
And how do you determine which one is important? Is it because the toes may have nothing to do with vomiting? Is that why you don't consider that important?
Probably. If I looked at your toes and it was hanging off, that would be serious. But if you're eating, and if you told me you're having abdominal pain, you're nausea and vomiting, chances are more than likely you haven't been eating okay. The nausea and vomiting could be related to like medication or food that you ate, some kind of food poisoning, something antibiotic or something like that. So we want to make sure. And then because if you vomited, you become dehydrated. And when you become dehydrated, that can also affect your heart and all. So that's the most important thing. Your toes would not be important at that time. Your keeping you well would be the most important one. And so based on that too, what I find after that, then I can say, okay, yes, you need to go to the emergency room, or I can give you medication and come back in maybe 48 hours to see, or let me know if anything changes in the next 24 hours.
Staying with the chief complaints, because I'm coming and you are kind of trying to decipher which one is more important. Does that have to do with my insurance and the time you have to see me? Let's say you have 30 minutes to see me, so you don't want me to put all my problems on you, so you're trying to just separate them. Will that factor in?
Not the insurance, because that part I don't handle. That your insurance and everything will be done prior to you coming into the room with me. The most important, like I said, yes, we all have a set amount of time to see the patients. So that's why the most important thing, even if you went into the emergency room, you went there, you say you were there for this reason, they're going to take care of the most emergent issue before they pay attention to the other ones. That one they can take care of later on. So they would take care of the most emergent issue, the one that would most likely cause you to have any issues with your heart or anything. That's the one we pay attention to first. It's priority. It's first priority.
And that's my chief. It doesn't matter which one I name first. You are not saying, okay, what he said first. Let's say for the example you gave, what if I started with the toes before I went to the nausea and vomiting?
Well, usually when you make the appointment, you're going to tell the medical assistant why you're coming in. So we'll know that it'll add that one first, and then they may add the toe part to it. They might add that later. They might add that in the same thing, but the abdominal pain will come first. So usually that not usually, always, like I said, the priority symptoms will come first, and then we can do that. I can always tell you, come back for your toes. Like I said, unless if your toes is completely black and hanging over like broken, then I may mention it too, and I'll say, oh yeah, follow up. You have to go to the emergency room. But my most important thing would be your abdominal pain.
What if I'm a patient and I'm not able to talk? How do you know my chief complaints?
Usually when you make the appointment, somebody would have made that appointment for you, right?
Okay.
So that person will tell you when they're making that appointment. We usually say, especially like for elderly people too, and I have a lot of patients who don't speak any English, we usually say, can you please bring somebody in with you? Because usually if you can't talk, you probably have somebody who's taking care of you. Or if you're an independent person, you have a manner, we have dictation services where we can use that to conduct the exam.
So that's my chief complaints, and that's part of the subjective part.
Yes.
Now the second part you say is what?
History of present illness.
Okay. The history of my chief complaint, basically.
Yes.
Why you need that?
Well, in order for me to get all the information for me to come to a diagnosis and treatment, you need to tell me what really is going on based on the questions I'm going to ask you. So that is in the history and in school. I mean that history is the most important part of the whole SOAP note thing, because that's the part that tells the story that we need to know in order to come to the most accurate diagnosis.
So, like for example, with the nausea and vomiting, the history will look like when the vomiting started, or
yes, there are parts. We use acronym. It's called old cards. The questions based on those questions. This is what we're going to ask you. So if you came in to see me, I'll say, okay, your chief complaint is abdominal pain, nausea, vomiting. So I'm going to start with the first one would be onset. First, that's why we usually, when you go to the doctor's office, the doctor always asks you, I'm kind of like saying, provider, because I'm saying doctor, okay, provider. You're going to ask you say, when did it start? The first thing I always ask you, so when did it start? So usually we ask onset. So you may be having abdominal pain, or you may be having something that a question or like an illness, a complaint that been bothering you for like a couple of months. So for the abdominal pain, you probably may say maybe it started like yesterday, but let's say you were having knee pain or something else like that. The first thing we ask you, when did it start? And then some people, like I said last time in the last video I was in, was when did it start? And we don't mean like the exact minute when it started, but you can say, let's say your knee's been bothering you since when. You'd be like, well, my knee was bothering. It's been bothering me now, I think. And then sometimes they're sitting there trying to remember the exact time it's been bothering them. And it's like, I said, when did this? Okay, remember maybe springtime when we were doing something. And that's when I think I went for a walk somewhere and I hit my knee. And so we ask you that, because if you said something that's been going on 3 months, that's been going, that's, you know, the acute care. That means like, okay, we need to pay more attention to it. If it's something that's been going on for about 6 months, then we, you know, that's chronic. And then the plan of care may be a little different too, depending on what the complaint is. You know, if you're having chest pain for 6 months, of course, that's going, you know, that takes priority right away. 3 months, if the chest pain started last night, and also the associating factors, that when we have to pay more attention to them. So we actually, the onset of it.
Onset.
Yes.
So onset is when it started.
Yes. When did it start? Like
We're going to history now, and then,
yes.
and then what else in that or oncar are you talking about?
We're talking about location. So if you were, if you came into me, you say abdominal pain, you're having abdominal pain, we'll tell you location. Where on your stomach, where in your belly does it hurt? I usually would say point to it, or most people point to it anyway. So it depends. If you're telling me it's right below your chest area, right below your like right here below where your breast is, underneath the bone, I may say, okay, you're having some reflux. Maybe when you're eating your food, the acid is building back up in your esophagus. So that may be a reflux. We'll call gastroesophageal reflux. And if you tell me, oh, the pain is like underneath my right breast area up here, I may, the next thing I'll be like, okay, let's make sure it's not the liver. If you're saying it's lower to my, right leg, my right pelvic area, that we're talking about your appendix. On the left side, we're talking about the spleen, and so we want to make sure that our diverticulosis, that's the lower left side. So depending on where the location is on your stomach, we know which disease that affects that.
That's interesting, right? Because we get asked this question, but we don't really think about it. Okay, where is location? So location is very important. We have the onset, when it started, and where is it hurting?
Yeah, where is it located? And especially when you come in, and women too, when they come in, it's like, okay, abdominal pain for women, you mean all of that. And then also you're talking about the pelvic region too. So are they having any issues with their reproductive parts that could be causing the problem? So there's an additional location complication when a female comes in.
So location. What else in history of present illness? I'm liking it because the last time I was in the hospital emergency, I was vomiting, I was having diarrhea, and they asking me, where it hurt, which side of your stomach. I'm like, come on, does it matter? It's my stomach hurt.
Yeah, and sometimes it's like it's all over. The pain feels all over. So then so we understand, because if your abdominal pain, nausea, the pain radiates to different areas of the body too. So of course, to the abdominal region. So of course we have to be like, we're not going to be saying, okay, exactly where. So basically we can go from there, that you having something in your stomach and some kind of food poisoning or something else is going on. So we can pretty much.
What if that pain was on my right side or my left side or in the middle? What difference does that make?
Like I said, the different organs are there in your abdominal region. Tells us it can tell you the onset and the different kind of diseases that's going on there. So because where your organs are placed in your abdominal region, because the stomach is on your left side, they're in the mid part. So if you say the pain is in your right side, my right side's been hurting me. And sometimes you can be having pain in your right side and it also radiates to your left side. So we have different testing that we do that we can determine exactly what's going on, because especially if you come in and you're in excruciating pain and it's on your right lower side, you say the bottom part of my right lower and it's hurting me so badly. Right away, we want to make sure that it's not appendicitis, and we have to get you to the hospital as quickly as possible, because you have to be in the emergency room, and then we in no time be in the operating room to take care of that. Because if your appendix bursts, that can just introduce poison all into your body, and that's very, very dangerous. So we have to make sure that we know exactly where it is, and just by the kind of pain, if you come in and I walk in the room and I see you like crunching over and you so much pain, you're going to the emergency room. I'm not even gonna do vital signs, call 911. You're going right away.
Wow. Onset, location, what else? I think
the next one is duration.
Okay, duration. So how long you been having this, right?
Yes. How long have you been having the pain? How long have you been having this, whatever is going on? Has it been, be like, I had it 3 months ago, or I had it 6 months ago, or I had it and then it comes and goes, and then, or I've had it before. Have you ever had this pain before? Have you ever been treated for this kind of pain before? And then so we ask you all those things. So those things are important because sometimes if somebody will say, no, I never had that before. Then that changes. Okay, this is new for this patient. It's a new onset disease with this patient. Or I've had it before 10, maybe 5 years ago, and another doctor did this and it went away and it came back. So now we're talking about recurring symptoms, and then we have to go on from there. So possibly you had it before, it went away and it came back, and you say it came back this time and then it's coming back and the pain is more intense this time around. So that right away I start, when I'm talking to you and I'm writing things down, right away my head is thinking, I'm thinking on different diagnosis and all that too. And I'm thinking, wait, this is what I'm going to do. This is what I'm going to do. So as you're telling me, I'm listening to that. And the duration also, like I said, it's like 8 parts, 8 parts. And that's when we start writing down what to go on, how to prioritize the diagnosis we're going to be.
Oh, wow. Yeah. It's trying to make sense to me now, right? As to what you're looking for as you ask these questions. And I like when you say this is the subjective part, because this is what I'm telling you.
Yes.
I could be, and based on that, you're going to do something. And I can't wait to get to that part that you're going to do based on what I'm telling you.
Yes.
So onset, location, onset is when it started, location, where is that hurting?
Mm-hmm.
How long it been hurting, duration, what else?
And the next one is characteristics. You can say that. Before I say there are other acronyms too. Some other providers use other acronyms, and we may not go in order because sometimes the patient may say something that would have to come back. So it's not always in order, but we try to go in order most times. So what did I say? Characteristics. So I'm going to ask you how's the pain? Is the pain dull? You'd be like, yeah, it doesn't hurt that much. Is it sharp? Is it burning pain? Because let's say you say your foot is hurting. Okay. So, and you say, it's hurting. I said, alrighty. Is it burning pain? You said under my feet, it's like been burning and all that. So right away, I'm thinking nerve, I'm thinking nerve damage, but it's been hurting and it's kind of bruised over there. Then that's when I'm asking you like what happened, and also different characteristics of the pain and the intensity of the pain too. That tells me like, okay, how I need to structure the medication I'm going to give you, and like, again, come to the diagnosis. So basically, by the way, when you're telling me all these things, I'm writing patient reports, patient stated. So everything, so in that subjective, when you go and look at your note, everything will say what you said, patient stated, or family member with patient at the time stated this. So that's everything you're telling me.
Sometimes they say 48-year-old male. Still.
Yes, I'll say, Mr. 48-year-old African American male presents today with abdominal pain. Right. Patient reports the pain, started, and then I go from there.
And I'm not 48. I'm just using that as an example. I'm way young. No, I can't say. So onset, location, duration, and characteristic, meaning, how is the pain? You say the intensity.
Intensity pain. Yeah, I mean, you're describing the pain. If it's a sharp pain,
okay,
is it dull pain? If you came in with sharp pain in your belly, and like again, like I said, depending on where you point it to in your belly, I would say go directly to the emergency room, or I'm calling 911, or I'll do all the different abdominal testing that I have to do to go on from there.
Onset, location, duration, characteristic. What else? And all this is part of your history of present illness.
Yes, that's a seven part of the history of present illness.
7. Okay.
Yeah, I didn't. Old cards.
Oh, okay. OLDCATS.
CRTS.
Oh, there's an R.
Yes. So the A is aggravating factors. So when patient come and they be like, when they come in and I say, okay, you're having a pain now, okay, right? What makes the pain worse? So you may say, I'm having abdominal pain. When I eat, then the pain is so severe. Or as soon as I get done eating, then I feel the pain and I feel it coming back here. Or, when I lay down, when I move around, or the way I turn if you're talking about, something, your arm hurting you or a bone hurting you, when I turn my arm this way, or when I turn this way, or when I sit up. So that makes it hurt. So usually if you just say, and if you tell me, no, I'm just saying that the pain is always there, that makes it serious, because then there's nothing you're doing that making the pain worse. And sometimes my patient would say, whenever I touch something, then, my hand, would hurt. And sometimes I joke, I'm like, well, then stop touching it. It's like, so they're like, what? Well, sometimes you have to just make people a little more relaxed when they're in the doctor's office, or else, they're already tense and all. So So I would tell you, okay, so what makes it worse? If I drink water and it hurts more when I swallow, I have the sore throat, but it hurts when I swallow, or when I do this, when I go to work, or when I wear this shoe, it hurts, or so different things that makes the pain worse. That also adds to it. So may say what makes, aggravating, and go on from there.
You see, I'm really liking this, and I don't know if people feeling what I'm feeling because I get asked these questions. The last time, because I work from home, and let me put my health out there. I work from home, so sitting in one position, sometimes 2, 3 hours, you are in from one meeting to the other. So I started having, these pains in my neck, sometimes radiating in my arms, and I was asked that question. They didn't say what aggravate the pain. They will say, how you ask that again?
What makes the pain worse?
What makes it worse? Yeah, because at some point I couldn't, I will have my hand in a certain position. I wouldn't, but when I'm ready to turn, so they asked me that question: what makes the pain worse? And I didn't know, they were after something. But thank you for telling me what makes the pain worse.
Mm-hmm.
And why you need to know that?
Because I mean, if you're, like I said, once again, if you're telling me that what makes the pain worse, then I can develop my plan of care saying, okay, what if you say, when I'm working the way I've been turning, or when I do this, so maybe I can say, okay, I need to do an x-ray in your arm, to see if there's anything going on there. I mean, maybe a nerve damage. I may have to do an EMG, and then also I may also refer you to see orthopedic. So orthopedic may have to do something else, or you may have to change your job, or you may have to do work in a certain way. Because some patients may say, I can't go back to work because whenever I lift a patient, or whenever I lift an object, let's say they work in a factory, anything, if they do anything pulling, pushing, or driving, that may affect them. So when I do write that, and they go to see another specialist, all my notes go along with them. And also your employer might say, oh, so what's the reason again? What's the reason that, you're saying they can be on light duty? Oh, by the way.
Exactly. That's what I'm about to say. I just thought, you're on light duty because when I work, with persons with disabilities, that's what, people are on light duty because, maybe you pull a muscle, strain because of when you are lifting the client. And so because of that, to say, okay, get on light duty because when you lift, you feel the pain. So, oh, wow. And this is very important because it will help me as a patient to think about what I'm telling the provider.
Yes, that is why.
Yeah, because
and it's very important for us.
Lightly.
Yes, and for us, it's like the most important thing of our notes is a history. That was like drilled into our head, history, because that changes the entire plan, and that's the most important part of everything is the history. And my teacher used to say, make sure it tells the whole story. So when I look at your notes and I just read the history of present illness, I can tell exactly that, and whatever the patient's telling you when you that's important also. So when you do your plan of care and assessment and all that, everything has to justify what you wrote in your assessment and the plan, because sometimes the insurance company or anybody else who, let's say for your workman's comp, they'll come back and say, oh, by the way, let's see here. And then they say, okay, can you justify why you order that test? Can you justify why you send a patient to this other specialist? All of that has to be justified based on your history of present illness.
And that's why I like this so much, because all that even comes into court, right? Yes, insurance claims and all that, because fraud, waste, and abuse. Because some orders 2-minute tests, or some will order a medication for no reason. And so you go back to the history of present illness and say, but based on what we see here.
I wouldn't say for no reason. I would say based on what you told them and based on what that provider may have come to a conclusion at the time. That they
what I'm saying is that could be a fraud, right?
Because there is fraud in healthcare.
There's a lot of fraud billions of dollars because of fraud, right? So doctor could be ordering something that they're not supposed to order because. And so if you compare all these, because I have a brother too who work with, and most of the time he represents his client in court, and they'll be looking at your subnotes. I mean, does that scare you?
Yes, yes. That's why malpractice insurance is so expensive, because it's like, you want to make sure that when you stay there and you work so hard to get your license. I mean, God, anybody who knew me going to school and I mean nursing school, NP school, any kind of school you go to is, but anything that has to do with malpractice and all that, and your license is at risk every day, you know. So you want to make sure that what you're presenting on that paper is what the patient told you to the best of your knowledge, the best of your knowledge, and I mean your remembrance, and also, and then that, I mean, like I said, and also come in insurance, Medicare, Medicaid can also audit the charting, and also that's very important that we make sure that whatever it is that we write down is what the patient told us, and also is being, represented accurately. So nobody wants to lose their license. So.
Oh wow, this is good stuff. Now, if there is an aggravating factor that is what make it worse, there should be a relieving factor too. I mean, I'm not a doctor, but I can tell
yes,
that if you are asking me what makes it worse, you should also ask me what makes it better.
We actually say, okay, what makes it better, aggravating and relieving? Also, that can be alleviating too. So what makes it better? So they may say, oh, when I sit down, I don't feel the pain, or when I get up and stretch and move my legs, I don't feel the pain. Or I've been taking, and sometimes we ask the patients we say, have you taken any medication for it? Or have you done anything for it? And sometimes some of them may feel like, oh my God, you think I'm here asking for medicine. You think I'm here asking for a pain meds. It's like, no. We just have to make sure what you've taken so far, because what if you came to me and said, oh, okay, I was having my knee pain. And I said, okay, well, let's try some prescription Motrin and going from there, because we always want to start at the least amount. And you said, well, I've been taking Motrin and I've been taking this already and it didn't work. So then right away, I've taken that out of there. Or and also not only that, I've been putting some hot pack to my knee. I've been wearing a knee brace. So all of that is included. So all the alleviating factors and all that, we add to that. And then based on that, also, like I said, you can say, been doing that and it hasn't worked. And so then right away I'm thinking, okay, so then we have to progress to the next level. We have to progress to the next pain medication, or we have to first of all, we have to do chest x-ray if it's something with the chest, or your knee x-ray, and then or also follow up with physical therapy, or also follow up with orthopedic doctor to go on from there. Because usually most of the insurance company, if you send a patient to if it's something that severe, would do like chest x-ray, we'll do the x-ray first, send them to orthopedic. The orthopedic can order MRI if they need to. So basically, it tells us where the next step is. If they've already done the least amount and the pain it hasn't been relieved, or they can't perform their regular activities, what we call activity of daily living. If it's affecting that, then we can move on to the next step. And
wow. Most people it's real to me because
later.
It's real to me because I've just been to the hospital. I told you I was sitting down too much. And so they asked me when does it get worse? Because when it was hurting, when I'm typing, because I'm on the computer typing, when I'm typing, it gets worse. So at some point they said, then when does it relieve you? Let me show you something. And we're going to role play here. I like this stuff because it's real. And I want people to take it seriously, because these things are life and death. If you're not diagnosed properly, because this was affecting my job, and just by doing few simple things based on what I was telling them, I got relief. So this is what I used to put on my neck. I plug that, see? And I plug that, and then it will be massaging my neck as I work. And I put my hands here like this, and I'll still be while it's massaging me. So this is real. Yes. That's what I want to emphasize.
And based on that, if let's say in a couple of months you're still having those symptoms, and you go to the doctor's office, say, you know what, I'm still having the symptoms. I know that you give me this brace to wear, or that device that you're wearing, and I've been taking medication and all that, and it was helping for a while, but the pain seems to be coming back and it's hurting a little bit more. Then we'll say, okay, we've done that. They've done that part. If you have physical therapy, we've done that part. Let's go to the next level. So based on that, we always, like, it's all your history of personal illness, also with the history that when you came in before, what we did. So let's say if another doctor was seeing you and I saw you before, they're going to read what I wrote the first time around, or even a physical therapist, they're going to read what they wrote over there and then move on to the next level. So that's very important. That's what we ask you. So what have you done so far that made the pain, that made the symptom a little more, relieve the symptom a little bit more, or it was to make you complete your work you were doing prior to the pain?
Wow. Onset location, duration, characteristics, aggravating factors, relieving factors. What
Yes.
else?
Time. So we ask
Time.
you what time the pain occurs, like what time of the day. Let's say if you say you're having a mind, wake up
Oh,
when
yeah, I
I
was
wake up in the
confused when you
morning.
said what time.
Yes,
I was gonna,
when you
okay.
wake up, when because it's kind of and kind of mixing there with the location, with
The
the time,
onset.
the duration too. So
Yeah.
it'd be like, what time does it, in the morning? Do you have the pain in the morning? If you listen, my bone hurts so much in the morning, but later on, it feels a little better. I'd be like, okay, we're probably talking about arthritis here. But if the pain is there all the time, then we may be talking about something else, osteoarthritis, rheumatoid arthritis, something else. If it, so okay, the pain is mostly at night. When I can't go to sleep at night, I'm coughing more at night than in the
Right.
daytime. And so the time of the day the pain occurs, or what activity you're doing at the time when the pain comes, that's how we can say, okay, if you're doing this during this time, then maybe that's what's causing the pain back and forth, and we're going from there.
I don't know if you know this. I was born in a village, right? So at night, that's the time you start coughing, and what they tell you, they say, oh, that happens because sickness says the tree that is falling, you can easily walk on it, right? So
Mhm.
because you are falling now, so that's why the sickness has more power to walk over you, and that's the only relief I got when I was. They say a fallen tree can be easily walked on. So you can walk on a tree that is standing. So they say when you are up, you don't get sick. It's when you lie down at night, that's when. So their
Yeah,
way of thinking about it, that time I was like, hey,
usually too, because also like when people say, okay, I was sick, but I'm getting a fever mostly at night, and as soon as in the evening, that's when I start getting sick, and then usually that's when your body is like resting, and you're not at the strongest, so your immune system is not as strong at that time. So of course, that's when fever and everything else is going on. Very opportunistic to find that time to come and attack you around that time. And also, if you're coughing a lot at night, we kind of look at it as if any family history of asthma and things like that. So different things, the time it occurs may kind of point us to where we need to be, where we need to how to diagnose you.
so ONCART is ONCARTS,
Old. Oh,
OLDCARTS. What's the S?
the essence of severity. That's when we actually
Oh,
like you say, okay, yeah, it hurts, kind of, and also like it could be also with characteristics. But usually that's when we say how how severe is it on a scale, the pain from 1 to 10, with 1 being the least and 10 being
yeah.
the most. If you say 10, then I know. Or sometimes even if you come in there and I can look at you, and sometimes you don't really have to tell me that, and then I know it is really serious. Of course, now people may be saying, okay, some people are going to come in there if they want something for drugs or something like that. They can tell you 10 right away. Usually we can tell, and we try not to just see somebody and say and stereotype them or say whatever, because nobody fits any stereotype. Just hire somebody who is like living in the suburbs, could be completely hooked on drugs. Somebody in the city could also be hooked on drugs. So we try to make sure we're getting, like I said, a full picture of the person. So usually you tell me the severity of the pain. And as I say, I say, okay, let's do this. When I start doing your physical examination now, so if you say your arm is hurting, when I start lifting your arm, I'll tell you lift your arm up yourself first, so I can see how you do it. And then if you can't do it and I lift it up and you're in a lot of pain, usually I can tell you, I can say, okay, with very little movement, the patient was in severe pain. So the severity of the pain. So I said, well, okay, say what is the pain now? The pain that you're having, what are you having now? When you don't take any medication, how much is the pain? And also after the medication, how far down does the pain go? Let's say if you were when it's really bad, my pain is about maybe a 7. When I take the medication, it comes down to about a 4. So I say, okay, what can you live with? What can when you to do your work around the house and to do things, go to work? What can you live with? Can you live with the 4? Can you live with? So they'll say it's not that bad, because if you tell me the pain, it comes down to like maybe altogether gone. I may not send you for any kind of imaging. I may not send you for testing. I may not refer you to another doctor if at that time, if it doesn't seem like it's indicated at a time to send you to another doctor. We'll just continue what we have to do, because as a primary care provider, there's a lot of things we can do before we start the next step. Everything we've done so far, we can't do anymore, and then we send you to a specialist, depending on the illness.
Ladies and gentlemen, we are talking about the provider's note. What you tell your provider when you visit your doctor, that what you say may constitute a major part of what the doctor will see as what's wrong with you, your diagnosis, and how you should be treated, your plan of care. So Abby tells me when you go to the hospital or when you go to see your doctor at your doctor's office, they first ask you what brings you here, and that's your chief complaint. After knowing the chief complaints, they want to know the history of that illness. So that's called the history of present illness. In the history of present illness, which is also called the HPI, we look at the onset, when it started, the location where it hurts or where it's located, how long, the duration, the characteristic. Is it sharp? Is it mild in case of pain? What are the aggravating factors? What makes the pain worse or what makes your sickness worse? On the other hand, what makes you feel better? And at what time of the day or night that you feel this thing so much that it's painful? And last but not the least, on the scale, and I just don't like, since I came out of school, I don't like to be asked that question. It's like I'm in class again. On the scale of 1 to 10. But they ask that to
I'll be like, and sometimes people be like, oh, and I'll be like, does it hurt this much? Does it hurt this much? For children too, we have the thing on the wall, different scale, and also patients who cannot understand English. Sometimes I might point to it, the face scale, where you can be like, are you crying that much? Is it so it has somebody just kind of sad and has somebody crying and one crying really wide. So you basically can tell if you point to it, they basically can tell you what it is. So
right. I think I prefer that. I don't want to feel like I'm in school again about on the scale of 1 to 10. But those are questions we get asked a lot when we visit a doctor, but we really don't know. But now you're explaining it, I can really, really relate to it. And our viewers, if you can relate to this stuff and you have questions, please post your question or you can call us and Abby will be able to explain that. Again, I want to go back because I know you can stress this enough. But before that, let me ask you this. HPI is subjective. It's based on what I tell you. And you can, how we call this stereotype, you really can avoid it. Okay. And the kind of unconscious biases that are in all of us as human beings. So you see someone coming to your practice and the person look a certain way or have a certain skin color or speaks a certain way or is doing things a certain way. Does that play into what they tell you? Like you see them, you say, this guy should be on drugs, or this guy, this person should be this way. How does that play into this HPI stuff?
I mean, unconscious bias is present in everybody, regardless of your occupation. I think the healthy way will be if I base on the fact that we know different cultural factors. I may say, okay, if you're complaining of a lot of reflux, a lot of when you eat, you feel indigestion a lot. If I know that, let's say you're Liberian, you probably eat a lot of spicy food. That may probably say, okay, this is the kind of food they eat. That maybe.
When you say spicy food, you mean pepper.
Yes, I may say, okay, then I will ask you, and simply because you're of that nationality, and also you could be also of that race, but that doesn't necessarily mean that that's the kind of food you eat. So I have to make sure that even though my mind may be thinking that, I have to be very careful and go ahead and ask more questions in order to come to that conclusion. It's very easy to come to that conclusion based on what the person looks like in front of you. But as a human being and as a professional, it's important that you check yourself and say, no. Because I mean, like I said, I had people who work at the methadone clinic, and everybody of every race and every social economic levels were there. So I always check yourself and say, nope. But at the same time, if somebody was homeless and they came into you and they were complaining of certain things, then if they were homeless, that means they're more vulnerable to all the elements of outside. And if they were, let's say they had history of any kind of drug abuse or stuff like that. So very well the kind of testing that you're going to be looking for based on their lifestyle and all. That doesn't mean you're not going to do it on the other person, but it just adds another layer of where you have to get to your diagnosis, and you have to be accurate to get that diagnosis, because you don't want a person to come back and say, I'm still having this, I'm still having that, I'm still having this, and you didn't ask that question, or you didn't ask and you didn't tell that test. And you also want to make sure you explain to the patient, which is one of the most important part, is explain to the patient and say, okay, based on this, and this, we're going to order these tests. because I think that this is what you, and I'm trying my best not to fall into that, but at the same time we want to do these tests and make sure we take the best care of you possible. That's why we're ordering these tests.
Right.
Explaining to the patient, explaining to the patient is the most important part.
And also, this is subjective too. Some people just follow drama, right? So they come there and like they are in so much excruciating pain because they want the attention, or maybe they came up with a significant other, and so they want to show that they're in so much pain. So when you ask from on a scale of 1 to 10, they even tell you 11. How do you try to separate, as one of our ministers would say, facts from fiction?
I mean, if they say 11, usually that's when then I'm going to be going back to when they said, aggravating factors and relieving factors. So what have you taken so far that's causing the pain to be in 11 and 12? And like I said, depending on where the location of the pain and the kind of pain that you come in with, and don't forget, when we're also doing the old cards, we're also doing associating factors too. So is this pain helps in stopping you from sleeping? Is it hurting you when you is it hurt when you sleep? Is it waking you up from sleep? Is it causing you not to be able to go to work? Is it causing you not to be able to be a father or a mother to your children, or even anything else you used to enjoy doing? Is it keeping you away from that? So based on all of that, and we asking, and also like I said, the medication that you've taken, the kind of medication that you've taken so far, and any other doctors that you've seen, have you ever had any issues with this before? Based on all of that, we can pretty much see that yes, the pain that you're having is very severe. Now, are there times where a patient may tell us something and it is not true? Of course, in every field that's possible, but eventually you're gonna be able to kind of sift through things and say, okay, yeah, I've seen this person a couple of times and I can see that this is what I'm doing. Okay, so if it's pain and we've given you this much pain medication over a period of time, it hasn't helped so far. Okay, we're about to send you to the specialist, and also send you to pain management, where they can do more diagnostic testing and then come up with a better plan of care. So we usually tell them that they can do a better plan of care. So the medication that we're giving you, we cannot give you any more than that, and I can give it to you more frequently than that. We have to send you to pain management. And sometimes it's like, okay, you needed to get x-ray, or like I said, MRI, ultrasound, that would tell us something more than what we saw when you first came in. It's not everything.
And that would be the assessment part of it.
Yes. So what are we diagnosing you with this time around? It could be different when you come back again, based on the testing that we've done to show us eventually, to show more accurately what it is that we didn't see the first time around. Or sometimes you can see until the testing's done.
And I like that part about the associating factors, because I remember I got asked that, right? So you were asking me for lifestyle, or what do you do? What work? Because if you work outside, it's different than when you work, at a table with a computer. So tell me briefly, just tell me a little more about associating factor and give a few examples so that our viewers know.
Sometimes a patient might say, I loved, my knee was hurting. I used to love going for walks. I used to love going exercise, but that's even if I just try to bend my knee a little bit to say I'm going to go exercise, it hurts so badly. Or when even the pain is so severe, because I say, okay, usually when people go to sleep, the pain is like a little subsides a little bit. But if that pain is so severe that you're not even sleeping at night, or is waking you up at night, then that goes up in my head that something else is going on there. Okay, so I'm like, okay, that sounds like, okay, something more we are dealing with here than just ordinary pain during the daytime.
So now we got through the HPI. So the next step where we go, which we're not going to spend time on, will be, now you're going to tell me what's wrong with me and what you need to do to fix it.
Yes. So that's when I'll do my physical examination. Also going back to the subjective part, we ask for your whole list of medications, because it's possible that, whatever it is that's bothering you could be caused from another it could be a side effect from one medication. It could be a side effect of, maybe sometimes patient will come in and they'll be like, yes, my friend was taking this, so they give me a pill and I took it too. And usually I'm like, oh, don't take any medication somebody else give you, please, 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 please. It's different. Don't do it. Yeah, but some people come in and be like, yeah, my family member was taking this medication and I took it and they helped me. I said, okay, right away, I write that down for alleviating factor. But we ask about your history. If you came in and say, I've been having this headache for so long and it's really intense, I said, and I may ask you, okay, family history. anybody has history of headaches in your family, you'd be like, I don't know, but my mother did have a stroke right away. That my brain says, okay, I'm writing something, I'm writing that down because that is a family history. That means that, okay, I'm trying to make sure that you're not having a stroke, that you're not having a migraine, that maybe having a stroke, or something severe is going on that may lead to a stroke. So that prioritizes everything else that you're saying to me. And then your whole HPI, I put all that together. Have you ever had any surgeries on your head before? Have you had any other issues before? You're dizzy? Does this happen? You have the headache in the morning, in the evening, when you eat whatever you eat that causes the headache? I mean, the noise. And so all of that, like I said, we'll be going, when you start telling me about your medical history and your family history, then we start going back and forth and I start filling in the blanks, because sometimes just the HPI may not tell me all of it, but when I get to the medical, when I get to your surgical or your family history, that can trigger something that would prioritize additional testing. And like I said, refer to a specialist.
Right. But I really understood how important the HPI is. When you were telling me first, I didn't, not that I doubt you, but I had other thoughts. But after going through it and listening to you, HPI is very important, and what we tell the doctor is very, very important. So
And
based on that, the subjective.
and also, I decided to do this show mainly because I want people, when you start having a problem, just remember what I said, that you put that on the screen and people can say, oh, I was watching this show. And so that way, when I go to my doctors, I can be able to answer the questions effectively, because sometimes we literally have 15 minutes from start to finish. That includes, getting the history and also getting doing a physical examination and documenting. So you want to make sure that you have all this. So when I'm going to my doctor, I'm going to write this down. So when they ask me, I'll be like, yes, okay, yeah, this is it. So right away, you're helping yourself. You have to be an active participant in your plan of care. So that's the most important thing. Don't just go there and think, oh yeah, I'm just going to sit here and they're going to ask me questions and they're going to do this. No, you have to be an active participant in your care. Okay, so that's why it's like important. I'm going to the doctors tomorrow. This is what they're going to ask me. And Abby did say they're going to ask me this, they're going to ask me that, they're going to ask me this. So when you get there, they'll be like, oh, wow, okay. You write everything down, and right away we get to your diagnosis a little faster.
Thank you so much, Abby. I want you to conclude on this, because this is not the end of the sub note. You still have other things, especially the objective part. So I told you all this, so you say, okay, let me do my test. Okay, do this test, and that's objective. And based on this is your plan of treatment. This is your plan of care.
Yes.
Conclude on those two. How the HPI goes into.
So let's say you came in and you were telling me that you were having nausea and vomiting, but after I get your HPI and get your medical history, do you have any surgical anything in the past, any surgery, no family history of this? I'll actually also about colon cancer, actually any kind of stomach cancer, anything in that region that anybody had any issues with, because sometimes some things are hereditary. I may ask you that, and based on that, I may say, okay, if you're having diarrhea, I'll give you some Imodium. If you're having anything else, I'm trying not to call any different medications here. Try not to call the brand name. And if you say reflux, I may say, okay, we can do some Reprisol that help you with that. Take that 30 minutes before your meal. So make sure you're not having a reflux. Try to stay away from spicy food, because people think, oh, I can have hot peppers from the time I was small and I have a hot pepper. I'm a Liberian. I can eat hot pepper to the day I die. No, as your body gets older, it takes, your body's like, okay, I can't handle really spicy stuff anymore. Some people can, like, no problem. Some people can do it. But after a while, you got to say, okay, your body cannot take care of certain things anymore. So you have to work with your body to work with where you are. Don't sit down there and think that, okay, yeah, I was 20 years old, I can do it. And when I'm 75 years old, I can still do it. Some people can, like I said. But at the same time, when you start having problems and disease process start stepping in, you want to make sure that you work along with your body. So then based on that, I'll write your medications that I want you to take. I will tell you how to take it, when to take it, everything, write the instructions down. Usually we're not writing prescriptions. We're just sending it directly to the pharmacy. If you have a pharmacy, we just send it directly to the pharmacy. And then if I decide that based on my physical examination too, I say, I want you to get an ultrasound, or I want you to get like an x-ray, or I want you to get a CAT scan and things like that, because I want to see more what's going on. And based on your history, family history, I want to see maybe else there's something going on that I don't know of this time, because when first time you come there with a problem, I will know everything. And then based on that, we, like your plan plan of care and I tell you when to come back, I'll call you and tell you how. We'll go over the instructions, go over the test results, and then go on from there and see if I want you to follow up with a GI doctor. If it's your knee or something going on, I may say go for therapy, or I want you to follow up with orthopedic and see, because we treated you a couple of times and so far the pain is still there. If it's very serious, I may say, we'll send you to orthopedic right away. And sometimes the thing about it is trying to see the specialist, certain specialists, it's, you won't get to see them for like almost like 2 months or 3 months or so. So at that time, we're still managing your care, because we can manage your care up to the point where we say we have to send you to, and it's very important that we as internal medicine people, we have to know when to refer, because you don't want to delay somebody's plan of care. You don't want to then delay diagnosis, something that needs a specialist treatment, then that could cause a problem later on. So you want to make sure you know when to refer. And if I need to do any like lab work, also that will be part of the plan of care.
Thank you so much, Abby. I want to thank our viewers for staying here with us. We just got 2 comments. One of it from Wele say, hi, beautiful. And Aliyu Samba say, your guests speak a little too fast. You can slow down. Don't mind, Aliyu, everything you like to put politics in it.
I'm sorry. Yes, I know I'm a fast speaker, and I am trying to come there. I do get to the point where I speak fast, but like how some people speak really slow, some people speak really fast, and I'm sorry.
So one last thing is I want your pattern comments. People who are watching now and who will watch later, conclude with why this session was important and what you want our viewers to get out of it.
Like I said, I want everybody to be empowered and to be an active participant in a plan of care. Also, prior to going to NP school, like certain things, you go there and then you walk out of the doctor's office and you're like, oh my God, I forgot to say this. Or did they diagnose me with this because I didn't say this? Or did they do this because I said this? And also you want to make sure that empowered, meaning you know all the different parts and how to answer the doctor's question when you go in there. Because usually, like I said, it's like 15 minutes, if your new patient is like maybe 30 minutes, but it's 15 minutes. So all these questions that I ask you, it's not going to be asked the way I'm asking you. They're going to be like coming at you quickly like that. And some of it won't be asked in accordingly too. So at least that way you have it written down. So when you go into the doctor's office, that way you go in there, you be like, okay, I have everything written down. And, we appreciate that. But the most important thing is you as a patient, and I'm also a patient as well. When I go see my provider, I want to make sure that I have all that. Even in the hospital too, when you go into the emergency room, they ask you that. And then when you're in the hospital as well, when different specialists come to see you, they're going to be asking you those questions as well. So you want to make sure you're empower yourself by making sure you have all this information. You know how like people who do IT and things like that, they tell us certain things. Okay, do you know how to do this? Do you know how to do this? I'm teaching you this. So that way, when the computer goes down, you know how to work it back. So basically, this is my service to say, I want you to be empowered when you go into the doctor's office. So all this information I'm giving is to empower you. So when you go there, you're part of the plan of care. When they finally discuss the plan of care with you, you'll be like, okay, I can see why they did that. Okay, I can see why they did that. And then sometimes they'll tell you if you have any questions, call the office back. And if you have to come back in, we'll set up another appointment and we'll go over with that. So an empowered patient, you know very well you're working with a team. They multidisciplinary team, but at the same time, you are the center of the team. So remember that. It's you. It's all about you. It's all about you.
Thank you so much for your time. We do appreciate what you do, and really want you to come back so that we can do a last show on this, because it's very important. Don't mind that you don't have whatever, maybe the thousands of viewers watching at the moment, but it's very important. And so when you are doing something this significant, feel very, very accomplished, feel very proud of what you're doing. So we really, really appreciate this time. I want to thank our viewers that been here with us.
Can I just say one more thing?
Yeah.
It's not. I was on the show the other day, and somebody asked me to say when I said that I don't see the health plan for the different political parties, the Liberian political parties. Sorry, my American viewers. And somebody said, asked me to say, well, who are you that think that somebody's supposed to be showing you that? I said, I'm nobody, but I'm also a granddaughter of a lady who worked very hard, very, very hard from sunset, sundown to sunset, working so hard to take care of her children and the different people in the villages. And I put myself in 15 gate, we came from 15 gate, and I put myself in her shoes. So and to send her children to school, grandchildren, and where we are today. So I would hope that, she put me in that position for me to be able to advocate for other people who are in that same position today. So it's not about me. It's not about me thinking that I'm so high that I want to see anybody's health plan, but you're going to be taking care of your citizens, rich and poor, and mostly poor in Liberia. So I'm putting myself in that position of my grandmother, who I will hope somebody will be in another country, somebody who are educated to come back and advocate for me. So that's the reason. So anybody want to ask me, who do I think I am? I'm my grandmother's granddaughter. I'm Ethel Phillips Taylor Phillips' granddaughter. Okay, so that's who I am.
On that note, I want to say thank you so much for watching. We're going to end with our song that says, "We are all Liberians." Have a good night and God bless you.
We are Liberians. Liberia is our home. Liberian people. Liberia.